Hello, my name is Audricia Harrington, and the disease I chose to talk about today is going to be stroke. What is a stroke? A stroke happens whenever there is the blood that is rich in oxygen, whenever it's not making its way through the brain to get through our brain cells. That's what causes the stroke. Our brain cells are very sensitive, so at that moment where we don't have any blood and oxygen going through our brain to get through our cells, it's going to be not a good thing because cells can't rejuvenate themselves. Once we lose brain cells, they're never coming back. So when someone has a stroke, it's not any blood or oxygen getting through the brain, and the cells get ready to die off from that happening. I'm going to talk about different types of strokes. The first type of stroke I'm going to be talking about is going to be ischemic stroke. That mostly happens where there's a blood clot in the blood vessel that's feeding the artery through our brain. That's what happens whenever someone has an ischemic stroke. And ischemic stroke is one of the most common types of strokes that people mostly have. And like I said, there's not any blood reaching the brain cells, and there is something called thrombosis, which is something that forms in an artery wall within the brain. Actually, between the neck of the brain, I'm sorry. Another type of stroke I'm going to talk about is hemorrhagic. Hemorrhagic strokes commonly occur where, say, someone may have an aneurysm and there is blood leaking inside of the brain and your brain is swelling really, really bad. That's a horrible thing to happen. And it's just the blood in the brain tissue is just leaking. And when someone has an aneurysm, your blood vessels are being ruptured, and also hypertension can also cause a hemorrhagic stroke. And it's called hemorrhagic because the hemo means blood, so it's basically your blood is ruptured inside of your brain. Another type of stroke I'm going to talk about today is going to be mini stroke. Mini stroke is where someone is having symptoms of a stroke that are lasting it could last from minutes or to hours, but it's just a huge sign that a real stroke is coming. Signs and symptoms of a stroke. That could be facial drooping on one side or both sides, arm numbness or weakness, slurred speech, difficulty talking or just walking, or difficulty understanding what's going on at that moment all of a sudden. So if you ever see anybody and you talking to them and they just stop talking and their face just droop down on one side, you need to call 911 because that person is absolutely having a stroke. Excuse me. Causes of stroke. The number one cause of stroke in America is high blood pressure, high cholesterol, obesity, diabetes, and also those who smoke are highly likely of having a stroke. And also, what happens when you have a stroke is, like I said before, the loss of blood supply or bleeding inside of the brain. Those are the causes of stroke. And when you have a stroke, there are areas of your brain that are going to be affected. And one major part of the brain is the brainstem. The brainstem controls, your breathing, your heart rate, your digestion, and just pretty much, major functions that we need in our body. And when someone has a stroke, and if that brainstem is affected, then the cause of that is most likely going to be fatal, because if our brain can't control the major key functions of our body, then you have no life there. You basically would just be a vegetable. You would just be laying there. So that situation would be fatal. So the brainstem will be affected, the cerebellum will be affected, and that's about it. Just overall, your brain is going to be affected. And also your muscular system will be affected too. Say when someone has a stroke and they're not able to use the left side of their body, so their muscles are not going to function. So your muscular system is affected too. And one thing I want to point out, what I didn't know before, I did this research, is that the left side of your brain controls the right side of your body. The right side of your brain controls the left side of your body. So if you were to have a stroke in the left side of your brain, the right side of your body is going to be affected. Just like if you have a stroke on the right side of your brain, then the left side of your body is going to be affected. And that's going to cause speech problems, slurred speech, or if say your the right side of your face was affected by the stroke and you're not able to hold your mouth up anymore, you're more than likely going to have speech problems. And when you have a stroke, when you go to the hospital, they're gonna they have to diagnose you with the stroke in the first place. So they're gonna run so many tests on you, and diagnostic tests and lab testing, to try to figure out, they know you had a stroke, but they still have to diagnose you with that stroke. So they're gonna do something called a blood count test, where they're going to count the red and white blood cells inside of your body, or they're just going to be looking for any conditions that you may have had prior before having a stroke that you didn't know, something such as anemia or any kind of infection that you might have had inside of your body. Other tests they're going to run will be a CT scans, MRI, EEG, and EKG. They're going to also run that on you to take a look at your brain. To prevent a stroke from happening, some things that you can do that can help, but you can, if you have high blood pressure, try to lower your blood pressure. If you're overweight, you're obese, just try to take precautions to try to lose weight as much as you can. Exercise more. If you're a smoker, quit smoking. And if you're a diabetic, just take care of yourself overall. You just want to try to do things that's going to prevent that from happening. But at the same time, it's people who are completely healthy and can end up having a stroke versus somebody who just don't take care of themselves. They might not ever have a stroke. So it just depends on, your body. But at the same time, if there's ways to prevent a stroke, then just try to, prevent that from happening. Nobody wants to have a stroke. Treatments for strokes will be blood thinners, something called a T-PAC, which is a clot buster. It's supposed to help with the blood clots, or just try to prevent any more brain damage from happening that has already happened. Other treatments for a stroke would be speech therapy. They have rehab facilities that will try to help you gain some of your strength back, to try to encourage you, that even though you had a stroke, you can still live. You can still move on with your life. They have occupational therapy and physical therapy. Just to throw some numbers out there, for each decade after age 55, among adults, 35 to 44 people will have a stroke out of 100,000 people per year. Age 65 to 74, out of them, 670 to 970 people out of 100,000 people will have a stroke per year. This is just some numbers.